if an individual who is physically able to return to their activities, whether that be running, cycling, skiing, whatever activity they really want to get back to post injury and post reconstructive surgery of the knee, if they were to come to me and ask for advice on how to get more confident to be able to get back to their activities so that there wouldn't be as much anxiety or worry with that process. I would start with a couple of things. First of all, I would, explain to them that fear is very common. When you experience an injury, you experience it both physically and mentally. It's a mental and physical trauma. And the emotion of fear is experienced by everyone who goes through something like that to different degrees, depending on the injury. And it's more what you do with that fear that can change your outcome. And so explaining that fear is an emotion, that it's common, can really help in the first place. Because a lot of people feel ashamed to even admit that they're fearful of returning to an activity. Once they've admitted it and you explain that it is normal and that it's a common emotion that everyone goes through, that can often make them feel more comfortable and put them at ease and have them understand that this is just something that everybody going through this deals with in their own way. So that would be one thing that I would explain to them. Then I would try to have them accept that their emotions are going to happen. So fear is going to happen. And the sooner you can accept that there's going to be fear at different times. So if you're skiing and you're feeling great at the top and then you hit something on the way down and you start to worry a little bit, that's normal. So accepting that you're going to have these thoughts and these feelings, again, it's that normal piece. So that expectation. Then I would encourage them to challenge their knee, if we're talking about an ACL reconstruction, to challenge their knee after they've done their rehab and the strength is there, to challenge their knee within the activity or sport that they want to return to in a safe environment. So to take little baby steps of what they would like to return to and test it out and make sure that they're able to perform it, that they feel comfortable doing it, and that will also then help convince them and prove to them that they have the capability. Then I would encourage them to reframe their thoughts. So the process of reframing their thoughts would be understanding that they're going to have this thought. It might be a negative thought, it might be a worry or a fear that comes to them. And then sort of acknowledge that it's there. Is that thought truthful? So sometimes we have a thought like, my knee isn't able to do this. It's not strong enough. But then you can have that moment where you're like, actually, it was tested by my physiotherapist. It is strong enough. I know that I have the function. So my thought and the reality are different. So how can I reframe this? Well, I can say to myself, well, actually, that's not true. My knee is strong enough. It's going to take a little bit of time for me to feel comfortable doing this. And that's okay. So reframing their thoughts and having a systematic approach and plan on what they would think when they're back in their activity, so that when these negative thoughts come into their mind and they have to encounter them, deal with them, and then quickly respond to them, they have a plan of what that's going to be. So that can include having keywords or special things they're going to think about, very task-driven things about what their activity is, what their body actually needs to physically do in order to do their activity and that skill well, is a way of sort of putting thoughts into your mind that keep your mind preoccupied, or occupied, I should say, on the right thing, so that those negative thoughts or those other thoughts that come in and those worries and anxieties don't take over and affect the confidence. And then I would really try to have them work on, through different mental strategies, just how to focus the mind, so that when they have those keywords and those planned thoughts, they're able to really quickly change from that emotion piece to the piece of action And the better they get at that skill, the less they will hesitate when doing their sport. And if I've found that hesitation can really lead to re-injury. And so it's a really important piece that often gets missed is dealing with the hesitation that comes from anxiety and worry of performing a task. Because when you hesitate in that split second, you stop doing what you were supposed to be doing properly, and you have an increased risk of something going wrong. And so explaining that, teaching that concept, understanding that they need to have a plan in place, just as they do from a physical perspective of strength exercises and a plan of recovery. They need a plan in place of what strategies they're going to use mentally to be in the best position they can be, so that physically and mentally they're ready for their activity.